The conversation really has in the last year or two shifted from this being criminal to this being a public health crisis. And how much has that shift in conversation helped and changed the way that you do your jobs?
I think part of what I hear and what I deal with is still is a lot of the stereotypes of drug use, and that's why, again, just to give you props, I mean, the more all the media outlets can be talking about this, we need to break the silence around this and the stigma around this so that people can talk, and the experts can tell us much better than I can that the physiological effects of this are radically different. I think the Adams Board has done a great job of defining this as a brain disease. Having said that, we need to get people to have much more compassionate hearts, as the judge even was sharing stories before, right? I mean, you'd like to think that nobody sets out to be an addict, and nobody really wants to live that life if they knew there was a better way. And so we need to break down, we need to move beyond our stereotypes. It's all that just a drug addict, because again, this is transcending every socioeconomic background. Mm-hmm. And how do we bring compassion to that person and then align the right resources? I think, again, what I keep bumping up with is the stereotypes. It's a drug problem. Why are we reviving? Why are we wasting our money reviving? Well, eventually that could be your grandchild.
Mm-hmm. And certainly the Adams Board public awareness campaigns has only made slight dents, we believe. While we're really doing a good job with social media, we have placards, we have kiosks, we have informational workshops. We know we need to do more to talk about it as part of the public conversation. And my definition of collaboration is twofold: working together with other systems, other concerned citizens, but also asking that other service, other system, and concerned citizens, can we put our nickels together to make a quarter so we can expand those services and needed funding? So that's my twofold definition as I look at Judge Matia. That's my twofold definition of collaboration.
The Adams Board has been a wonderful partner, as have so many others in Northern Ohio. I think the public could see what I see as far as people working together across institutional lines. They'd be very impressed. Law enforcement, the U.S. Attorney's Office, independent police, suburban and the City of Cleveland Police Departments, the Adams Board, Dr. Papp at Metro, really would make the public proud. You hear the bad stuff in the news. You hear the story about the outlier sheriff in Butler County who won't provide Narcan. But what the public really needs to understand is he's the outlier. Most other police departments embrace harm reduction techniques. You can't get a guy clean if he's dead. So you engage in harm reduction techniques. So Northern Ohio is the birthplace of AA. We're lucky we have that infrastructure there. But what we need is the medical community to partner with us. St. Vincent's is doing some interesting things that should be assisted. Trouble is, the way the laws are, and the way Medicaid reimburses, there's not a lot of financial incentive for healthcare providers to get involved in the game. And we have, I don't want to get into the IMD rule, it's complicated, but that limits how big the infrastructure can be to 16 beds in a facility. 16 beds doesn't do it. So would we limit the number of, again, chronic disease example, would we limit the number of diabetics we treat in a hospital to 16? That's a rule that needs to be re-examined. So things are good in Northern Ohio in terms of cooperation, collaboration, but we need a more powerful person than all of us individuals at the table, or a more powerful entity to design a better system, who has the authority to design a better system, to incentivize doctors to go into addiction medicine. You know, when I spoke to Congress, I pitched the idea of let's do a loan forgiveness program for people who go into behavioral health. You know, we're gonna need, even if we had buildings, we still need bodies. So we need to incentivize people to do this difficult but very fulfilling work.
You know, I think it's several things. I mean, I think in terms of, especially resources, you know, we've been taking a close look at ourselves as it relates to this problem, and we've tried to do things like, you know, we have the Perry program. We have a box that people can bring their, you know,
Drug drop box.
drug drop box.
Yes.
You know, we have those
There's
things.
50 of them or so in Northeast Ohio, right?
Right,
Yeah, right.
and we're looking at a fast response team too when people do overdose, and those conversations are being had, and there's discussions about the changes of the needles, you know, the clean needles, because, you know, once again, you don't want people dying if they don't, you know, if they don't have to, but
Harm reduction.
you know, and we have to kind of look at ourselves, you know, because one of the things we were talking about is narcotics for us has now become the biggest problem in our city, in our county, and they're also responsible for a lot of the other crimes that we have.
Right.
And yet we only devote a very small percentage of our manpower to the enforcement of narcotics. And that's because we lack the funds.
Right.
You know, a lot of our city money has been taken from the state. You know, and that's money that we could be using locally. Our ADIS board went to the citizens and put in a ballot to create some more treatment program, but it was such a large amount that it got defeated, you know. And I think it is going to take somebody from the national, federal level and the state level to really understand that this is a huge problem that needs huge investment, and make it available to every part of this team, you know, whether it's the treatment, prevention. You know, we don't even do any prevention anymore. You know, we don't have their programs, we don't have those kinds of, and I think they had an impact, truthfully, because we went through a decade or so where we didn't have, you know, this huge problem, especially with heroin, and but we don't have those programs anymore, you know, and you know, there's no money for treatment, and there's no money for enforcement, and enforcement is still important because you have somebody out there who's trafficking in this. You have people who are creating and producing this synthetic fentanyl, you know, and it's difficult to stay on top of it because they're always changing the chemical compounds. Once we pass a law, they change the chemical compounds, and it becomes complex. And so I think instead of talking about some of the things we're talking about at the federal level, they need to understand this is a national crisis and devote the energy and the resources.
The arrests are important from a non-trafficking region. Let's, you know, unfortunately, the criminal justice system has been the de facto, you know, treatment provider in this crisis. So until that changes, you know, I don't get any drug court clients unless somebody gets arrested. And the hook we have in drug court that mom and dad, the parent of the heroin dependent individual doesn't have, is I have an ability to hold them accountable. That you know, I've got a couple guys who have guns and badges and handcuffs, and if you're not going to be compliant, you know, go get you, and you'll sit in a holding cell, and you get a chance to re-examine how committed you are to recovery. We know that incentives work best rather than sanctions, but having that ability is a really leverageable thing that leads to people successfully recovering. So we need our friends in law enforcement to bring us customers.
And
Go ahead.
oh, thank you. As we talk about state and federal and even local, my only caution, and this is strictly Valeria's opinion, is that at times our dollars are so earmarked and prescriptive that while it might be a generous number of zeros behind the allocation, it's targeted only for a particular use within this crisis. My voice is very loud in saying that there are gateways, as we earlier identified. In my background, we know that marijuana is a gateway.
Right.
We know that the sedatives and the list goes on. So while we're trying to combat this, or at least even if we get neck and neck with it, I'm not sure we'll ever be ahead of it. Let's make sure that our dollars are best prescribed its use based on the community in which the dollars are funneled to. Because we know that maybe a fraction of the allocation could go to support our continued CIT, crisis intervention training for police officers, where we've done a very deliberate job of integrating information around substance use disorders and the disease of addiction. So that's what I hope that they probably would never ask me to testify in front of Congress, but I would hope that the allowable use of the dollars with all the right intentions can help with the disease.
Judge, when you were talking about mom and dad with their child, one of the really difficult and painful pieces of this is mom and dad in this case are often 70 and 80 years old, because a lot of the people that are struggling with this are their adult children who are in their 30s and 40s. And so part of it is also in the spectrum of education. You know, a mom and dad know their child always like the back of their hand. We need to educate and empower moms and dads when they see their child, their adult child, 20, 30, 40 years old, not them their best selves, to really raise the questions. The other parallel to this is, if you think about public health crises, so when Zika was a problem, we literally, the world aligned its best resources to eradicate that. Thank you God, right? Or when Ebola was, same thing. You know, that's my phrase, the collective public will. That's the energy. And I had just a good perspective. For me, it was Memorial Day weekend. You know, and that was terrible, terrible. There was the terrorist attack in London. And on the news on Tuesday after Memorial Day, they were talking terrible about the 8 people that lost their lives. And the very next news story was about the 14 people that died in Cuyahoga County alone because of heroin overdose. And again, one is not right or bad, they're both terrible and they both need to be addressed. But how do we literally put the spotlight, if you will, that energy on this, we need to deal with this. Your family is going to deal with it whether you like it or not.
The Adams Board has done wonderful things with funding of our limited but wonderful treatment friends, Cel Rivera, CATS, Community Assessment Treatment Services. Stella has a detox, but again, it's 16 beds.
Right.
So we need to, one, understand the disease, because when you understand the disease, you realize where's a point where you can do the greatest good in getting people to walk towards recovery, to want it, who are ready for it. And sometimes when they overdose and they get arrested, they're still not ready. But you just got to have the resources available for when that switch flips in the person's mind that today's the day, I don't want to do this anymore.
One of the ideas that in all the conversations and the meetings, discussions that I've had about this, is how do you do 2 things. One, the Dalton Foundation is preparing an app actually that'll be able to be used regionally, so that so all these resource providers will load into this. It's much like hotels.com. I am 28 years old, I am a male, I am in this city, and I need help dealing with this. And it will say, here's the bed that's available. Call this number right now. So the Dalton Foundation wonderfully is working on that. The other piece, and I've had conversations and some of the discussions I've helped stir up with the Attorney General. In those moments when they're ready to act, they literally need a phone call to talk to a person who will find a way to connect with them quickly and walk them forward. In that moment, they're ready to act, and they need somebody to accompany them on that journey. But that really raises, as the Chief said, the question, this would be most effective because our first responders really are not equipped to be able to do this. How are we going to fund this so that phone call gets them somebody there that then walks them to a better place quickly?
And the Adams Board has funded a program on a very modest scale that does just that. We're trying to grow that application, if you will, whereby it can then have the awareness real time, which is the important part of this, availability of services. We don't have that component yet, but you can speak to a person, licensed clinician, 24/7 by this application on the phone. Now, I don't know what kind of phone it is, but it's an application that we funded. The program is through Essentia, and the partner agency is one of our funded agency, New Directions. And so far, the information that we've gleaned from the utilization is very positive, extremely positive. So we know that that's another real-time way to be connected with a person. Prevention is also an area.
What about the Adams Board hotline number?
I'm sorry?
The Adams Board hotline number.
Absolutely.
We need to get that up.
Yes, we have a hotline number. The area code is 216-623-6888, and that is 24/7. We also have a strong partnership with United Way 211, who has a very elaborate list of resources throughout the county, and that's just to name a few.
Right.
So just wanted to make sure that I enjoyed the application part.
I just, once again, have to reiterate though how important it is, and I think apps are good, hotlines are good. It's a human being coming immediately and connecting to that person and being able to tie in his support network if he has one, his parents, his family, or anybody who loves him, and just convince him this is the time, and then not only have a place to take them, but also be able to provide that transportation and that media support. And I think without that, it's not going to work.
We've talked a little bit about the bed situation. Is there momentum? Is this legislation that has been proposed to sort of double the beds? Is there enough momentum now to get this done, or are we still going to be wrestling with this issue a year from now?
I think we're still going to be wrestling with it a year from now, only because
Without a doubt.
I know that our addicts board, and I don't know if you know Tom Stuber in Lorraine County, has been putting out emails almost every day. Please contact this congressman. Please, Medicaid's the loss of Medicaid is going to kill us, and it's going to affect all these people who need treatment. They're not going to have the funds, and the agencies aren't going to be able to have the funds they need. And so I don't feel confident that they've embraced, or our Congress or state has embraced, the value of these human lives.
In the interim, while that, and I agree with you, Chief, that I don't believe that it's going to have a resolution. And just how archaic IMD rule is, it stands for Institute for Mental Disease. So that's the 70s, 60s, maybe even the 50s. But what I do think can help, and what we're funding and growing, are recovery housing, whereby individuals who are still some level of ambivalence in some of the homes, they certainly can be lived there while on medication-assisted treatment, as Judge Matia, and we know that medication-assisted treatment works. An abstinence-based model does not work. It's not nearly as effective as medication-assisted treatment. So in the meantime, recovery housing, which is not a part of the similar rules under Institute for Mental Disease, while we're not encouraging large structures within communities and neighborhoods necessarily, we have really grown our portfolio of recovery housing resources for individuals. And then I'd just like to close my comments by suggesting that the behavioral health world must really become a system of benevolence and tolerance. We can't ignore an individual who has their 19th bout in detox, because recovery is so individualized and so personalized that it becomes challenging. Who are we to decide that this person is not yet ready? And that's controversial, even among our providers. But I really want to be the spokesperson of tolerance and benevolence in recognition of the severity of the disease of addiction.
That's a good point. Let's we're talking about people who need of help here, in a vacuum, somebody's kid, and you kind of portrays them as, innocent victims in a nice light. We need to recognize that these folks aren't very likable when they come to us. They have been turned by their brain disease into lying, conniving, manipulative individuals. And if we recognize that, we'll help them turn back into children and parents and employees and neighbors. I've seen the transition, and it is an amazing miracle to watch. You get somebody to come in, and they're, even knowing what I know, sometimes I don't want to take them. And then it's always the most unlikable defendant that surprises us to the greatest degree and keeps you going to work with the next most difficult person in recovery. So if we recognize, yeah, they're diseased and they're not likable, but they are worthy of saving. When you see the human potential of people, it's amazing. I went to Bill Denahan's retirement event last night, and I ran into 2 of my graduates who now are working in substantial positions in the recovery community. Nothing made my night more than that.
The other practical piece of this is, as we talk about the individual who's struggling with the addiction, we're looking at that individual in a vacuum, but they're part of a neighborhood. More importantly, they're part of a family, part of a community. And so, at the heart of this conversation is, it's not just helping the person that's dealing with the addiction. It's really the impact that it has on the whole. And that's, again, there's 100 reasons why we should all be engaged and really become much more passionate and involved in this. Certainly the respect and the value of each human life, the goodness, the potential that they have, the impact that this has on their families. These are our neighbors, these are our co-workers, these are our classmates and friends. And so this person struggling with this disease really affects a whole pool of people, not to mention the whole community. And again, that's where I'm going to come back and say, that's why all of us need to become more aware, more involved, break the stigma, break the silence, and really engage in this fight for this battle, this war that's going on. That is, if the numbers hold, and they probably will, the state of Ohio will lose 4,000 people in 2017 because of overdose, heroin overdose in particular. Think of the human toll, and again, that's part of particularly what I get to see.
Unfortunately, I think you're really low.
Wow.
Yeah.
Yeah, and I was just going to say that, like the judge said, these aren't very pleasant people to deal with. And I think there's when you talk about medical people and people in professional fields, they don't particularly want to come down and deal with that in those individuals. And so maybe one of the answers would be, it seems like the more degrees you get, the more advanced degrees you get, the less you want to deal with people who are unpleasant, whether they're mental health patients, whether they're homeless, or whether they have substance abuse problems. And so maybe the answer would be to have paraprofessionals or people who have 1 year or 2 year degrees, that are easier to get, young people who are struggling, want to help, want to make a difference in somebody's life, but maybe don't have the ability at this point to go and get, and to create a cadre of young people who are willing to come out in the evenings, who are willing to come out in the weekends and make a difference. I think that would be a less costly way of putting some help out there immediately in the next year or two.